Dry needling is an ever-growing form of pain relief. More and more people are discovering the effects of this treatment. However, in some states, physical therapists are not able to perform this task. This makes it extremely difficult to use dry needling. In this speech, I will first educate my audience on what dry needling is. I will then give them the job description of a physical therapist, followed by the convenience of physical therapists performing dry needling, and finally, the state's involvement with this issue. I hope to persuade my audience to find out if physical therapists are allowed to perform dry needling in their state, and if not, find a way to get in touch with the PT board in your state. First, what is dry needling? Dry needling is used to relieve pain. The pain is relieved by taking small needles and placing them on trigger points in muscles to release or inactivate trigger points to relieve pain or improve range of motion. Second, what is a physical therapist's job description? Physical therapists are healthcare professionals who diagnose and treat individuals of all ages, from newborn to elderly, who have medical problems or other health-related conditions that limit their abilities to move and perform functional activities in their everyday lives. PTs examine each patient and develop a plan using treatment techniques to promote the ability to move, reduce pain, restore function, and prevent disability. Physical therapists are key to recovering for some patients who are recuperating from injuries, illnesses, and surgery. Physical therapists provide care in a variety of settings, including hospitals, private practices, outpatient clinics, home health agencies, schools, sports and fitness facilities, work settings, and nursing homes. State licensure is required in each state in a physical therapist practice. It is more convenient to go to a physical therapist than it is to go to an acupuncturist. More physical therapists are available than acupuncturists. There are about 240,000 physical therapists employed in the United States. Employment of PTs are projected to grow 28% from 2016 to 2026, much faster than average. There are approximately 18,000 licensed acupuncturists in the United States. Out of that number, it is estimated that only 12,000 are in practice, and that over 50% of those in practice are in coastal states of California and New York. It would be easier to schedule an appointment with a PT because they are more readily available. There are about 15,000 physical therapists employed in Texas alone. The state's involvement on this issue. Does your state allow physical therapists to perform dry needling? Most states have determined dry needling to be within the scope of practice for physical therapists. In other states, clinicians are working with their state boards to gain acceptance of this technique. I encourage you to contact Kineticore. Kineticore was founded to offer education courses for the manual therapist while actively participating in elevating the profession of the physical therapist across the globe. They are happy to assist anyone in approaching the state board on the topic of dry needling. California, Utah, New York, Idaho, and Hawaii are the only ones who have a ruling against dry needling, mainly due to the verbiage in the Practice Act against puncturing the skin. I recommend contacting your PT board to voice your interest in providing this treatment. So how do states determine whether or not dry needling is allowed by physical therapists? Most states have their own board of physical therapy that determines the rules. However, most states are pretty much the same. Texas Board of Physical Therapy Examiners says, the practice of physical therapy includes, but is not limited to, measurement or testing of the function of the musculoskeletal, neurological, pulmonary, and cardiovascular system. Rehabilitative treatment concerned with restoring function or preventing disability caused by the illness, injury, or birth defect. Treatment, consultation, educational, or advisory services to reduce the incidence of severity of disability or pain to enable, train, or retrain a person to perform the independent skills and activities of daily living, and delegation of selective forms of treatment to support personnel while a physical therapist retains the responsibility for caring for the patient and directing and supervising the support personnel. In conclusion, dry needling is an advancing treatment. It is a physical therapist's job to diagnose the problem, come up with a treatment plan, and help the patient rehabilitate. Dry needling helps restore the body back to a healthy state. I persuade my audience to find out if your state allows physical therapists to perform dry needling. If they do not, find an organization that will help you get in touch with your state's Board of Physical Therapist examiners, such as Connecticut. The number of physical therapists outweigh the number of acupuncturists. Make it easier on yourself and others. Get dry needling approved by your state. My sources include P. Baldry, Superficial Dry Needling, Trigger Point Dry Needling, Kelly Gardner, Dry Needling and Physical Therapy, APTA, Eric Rees, Dry Needling Getting to the Point, APTA, Janine Ugovarsky, Dry Needling, Salem Press Encyclopedia of Health, Physical Therapy Aid, Kelly Gardner, Role of Physical Therapist, APTA, Summary, U.S. Bureau of Labor Statistics, Acupuncture Information, and Physical Therapist, U.S. Bureau of Labor Statistics, Scope of Practice, Connecticut, and ptot.texas.gov.